Hi, I'm Dr. Mark Scott. I've been in practice here in Virginia Beach since 1996.
I'm the founder of the Total Health Center, and today I'm going to share with you how we successfully treat diabetes at the Total Health Center. If you're watching this DVD, we can just about guarantee one thing. You or someone you care about is frustrated with their health.
The first thing you should know is we do things a bit differently. The biggest difference is in our treatment philosophy.
Treat the person, not their diagnosis. Why would I say that? Well, a diagnosis is just a label, a set of words. It's what the healthcare system uses to classify us and put us into neat little boxes that fit the criteria set forth in textbooks. Here at the Total Health Center, we know that you're not that textbook definition, not some label. Instead, we know that you're a human being, for God's sakes.
Now, don't get me wrong, a diagnosis can be useful. If you came to me and said, I have restless leg syndrome, or my child has ADHD, we may have a place to start. But every day, people are misdiagnosed, given false labels, false hope, and needless worry. Where the problem lies is that the diagnosis won't give me the most important answer of all.
What is the cause of your problems? Yes, your child may have ADHD, but why does he have it? Without this all-important factor, how could we ever begin to think that we may be able to offer some type of relief, not to mention a cure for these debilitating and chronic conditions?
We know there are no cookie-cutter protocols for these conditions. We are dealing with flesh and blood human beings, not cold, unfeeling textbooks.
We begin by asking, what is the mechanism? Why is this happening? Diabetes is sneaky, potentially disabling epidemic that's sweeping America as we speak. Many of your family, friends, and coworkers will experience the same experience that you do because of a number of factors, including misinformation and inappropriate care. That's why I made this DVD. There are close to 1,200 doctors worldwide using a unique procedure that we use in my office. I help diabetics every day in my practice, day in and day out. You see, a large part of my practice is devoted to helping patients just like you. Please understand that uncontrolled diabetes can affect your vision. It can cause blindness, loss of limbs, kidneys, heart and cholesterol levels, risk factors for stroke and cancer. The information in this DVD is vital if you want to avoid years of increasing misery and frustration. So please view this DVD beginning to end. It may end up saving your life as you know it right now. You see, what's so dangerous about diabetes is it's not an injury like a broken bone or a cut or a scrape. Diabetes usually comes on slowly. You don't notice it at first, or you maybe just brush off the initial symptoms, such as frequent thirst or urination, thinking it's nothing. And then slowly, it builds and builds. You may start feeling numbness and tingling in your extremities, or you may become more irritable. And then one day, you realize you just aren't your same person you used to be. And that's when you go to the family doctor and get checked out. Most doctors do great with general medicine. If you have an ear infection or a severe cold, medical science can do wonders. But when it comes to a condition like diabetes, many doctors simply run a fasting blood test, find out that your blood sugar is high, and give you a medication, or put you on insulin if your blood sugar levels is really high. But they never perform a full battery of tests to get to the very cause of your diabetes. That's right, most doctors don't run enough tests to get down to the nitty-gritty of what's causing your blood sugar to increase even on medications. Diabetes is a tricky condition. You see, your diabetes can have a number of causes, and some of those causes aren't even in the area where you might expect them to be. Your adrenal glands sit right above your kidneys, and they are your stress glands. They play a huge role in diabetes. Your thyroid controls your body's metabolism, and it plays a huge role in your diabetes. Many doctors do not take the function of these organs into consideration when addressing your diabetes. Don't get me wrong, I'm not saying to not see your family doctor or continue with his care or her care to follow their recommendations. I'm saying that more testing needs to be done. Please, don't misunderstand me. I'm also not telling you to stop taking any medications. Do not stop taking any current medications, period. With that being said, here are the dark secrets. The main problem with the treatment some doctors prescribe for diabetes is that they never go to the root of the problem. They only focus on symptoms. That is all well and good, but there is more, much more. If you are taking pills so you can get through the day of work, then you are probably making your problem worse because you've sabotaged your body's only means of keeping you healthy. Obviously, this form of treatment is not a permanent fix. No matter how many pills you take, you'll never completely get better. Okay, so you've done the pills, and they don't seem to be working. What next? Typically, insulin injections. The problem is, insulin at high levels can cause a host of side effects, like weight gain, increased blood pressure, cardiovascular disease, increased risk of cancer, increased risk of stroke. All diabetic medications are simply treating the symptom of high blood sugar, while your disease continues to progress to the possible reality of insulin therapy. It's not that your body is lacking the hormone insulin. The problem for the majority of diabetics is that the insulin resistance has set in. This basically means that your body has lost the ability to utilize insulin appropriately. What sense then does it make to continue to bombard the body with something it no longer recognizes and can no longer process? Especially when that substance, insulin, may be harmful to your health and more than likely will cause your disease to progress. The definition of diabetes, according to the American Diabetes Association, is 2 fasting blood tests with a blood glucose level of 127 or higher. 100 to 126 is termed pre-diabetes or insulin resistance, and anything below 85 is hypoglycemia. So your ideal blood sugar or blood glucose levels should be 85 to 99. Think for a minute. Imagine how life would be if you no longer needed drugs. Imagine how life would be if you no longer had to inject yourself with insulin. Imagine if you had the energy to exercise and lose the diabetic weight. Imagine what life would be like without having to get up constantly throughout the night to use the restroom. Imagine what life would be like without living in constant fear of the devastating effects of this disease. You may have already had lab tests done, and the results came back negative. This is where functional metabolic testing comes in. In medicine, they use pathological ranges. These ranges are very wide, and if you have a positive test with these ranges, you are in the pathological state. You see, most diseases develop over time. It's a gradual process that eventually ends up as a diagnosable disease. Think of the dentist. Before you have a root canal, you have a cavity. Before the cavity, you have plaque. It's a process that results in a root canal. The pathological ranges are looking for root canals, not plaque. Functional ranges are looking for the plaque stage. For instance, blood glucose. The range can be from 70 to 115. Optimal is 85 to 99. Blood glucose can have an effect on your brain and nervous system. If you are getting to the edge of the pathological range, you're sick, just not diagnosable yet. You are comparing yourself with sick people. Functional ranges are comparing you to healthy people. We look at functional ranges. Unless you are seeing a doctor trained in this style of practice, you are not going to find the cause of your problem until you need a root canal. We will not leave any stone unturned. By using specific blood tests such as thyroid panel, a complete metabolic panel, a lipid panel, a CBC, or a complete blood chemistry with autodifferential,
we can assess your thyroid, adrenal glands, liver, kidneys, red and white blood cells, and gut function with the above tests. All can be affected with chronic conditions. By addressing these problems, we can help you heal faster.
Has your doctor run a complete thyroid panel? Your thyroid controls your body metabolism. So if you suffer from diabetes, it must be thoroughly checked. I'm not talking about a simple test for TSH or thyroid stimulating hormone. I'm talking about a complete battery of thyroid tests. Another test we do is sensitivity testing to determine if you have sensitivity to gluten, which is wheat, rye, oats, barley, milk, eggs, yeast, and soy. If you are sensitive to any of these food groups, it could be increasing your blood sugar levels. This could be why even though you are taking medications and exercising, your blood sugar levels keep increasing. It will increase inflammation in your brain and throughout your body. Adrenal stress index. You can test the adrenal glands with a test called the adrenal stress index. This is a salivary test, much like the DNA testing. The adrenal glands sit right above the kidneys, and they are your stress organs, meaning they react to stress. Your adrenal glands are just as important as your pancreas in treating your diabetes. An adrenal stress index needs to be run on you, which will check your cortisol levels at 8 a.m., noon, 4 p.m., and 10. Has your doctor specifically checked you for an autoimmune disorder? There are 2 parts to your immune system, Th1 and Th2. If one of these parts is dominant, you could have an autoimmune disorder. An autoimmune disorder is where your immune system is attacking your body, causing your diabetes. For example, you could have an autoimmune disorder in which your immune system is attacking your pancreas, and that is why you have increased blood sugar levels. 99% of our patients have already been to 5, 6, even 7 doctors with little or no long-lasting results. For the most part, all of the specialists look at only that part of the system in which they are trained. A cardiologist looks only at the heart and its vessels. An orthopedic wrist specialist, only the wrist. A dermatologist, the skin. You get the picture.
This approach has failed for a great many of us.
You have to take a step back and view the big picture, the person as a whole, not just the parts that make up that wonderful and complex being. With all the advances in technology, the big picture has been missed.
To get the great results we do, we must be really good detectives, trying to find the problem's root cause.
That means doing the necessary test, whether or not any out-of-touch and self-interested insurance company thinks they're medically necessary or not.
Are you suffering with some chronic condition, or maybe no one even knows what's wrong with you? Or worse yet, accusing you of making it all up? Or that it's just psychosomatic?
Have you tried various medicines and seen numerous and varied healthcare providers? Have you gone through treatment after treatment just to be let down again and again, made to feel like a burden and told to get on with your life, learn to live with it?
Thousands of patients just like yourself have suffered, felt hopeless and alone, and felt that no solution would ever be found, despite the many sincere prayers made for help.
So ask yourself the following questions. Honestly, consider writing down your answers. Number 1. How much has this condition affected your job, relationships, finances, family, and other activities? 2. What does it cost you in time, money, happiness, and freedom? 3. Where do you picture yourself in 1 to 3 years if this problem isn't taken care of? 4. What is it worth for you to be able to live your life without this problem being such a burden? You may have been told by other doctors that there's nothing wrong with you, or it's all in your head.
What that doctor should have said is that there's nothing that I know of to help you. If that doctor says that there's nothing wrong with you, then he or she assumes that they know everything.
You may at one time given in and just figured that you would just have to learn to live with it. Even if you believe or have been told that you couldn't recover, or you have a permanent, unchanging condition that could only get worse but never better, what if it were possible to be 30%, 50%, or even 80% better? What would that be worth? What about being 100%? What would you do to be able to achieve this?
Now don't get us wrong, we can't help everyone. That's why we thoroughly evaluate every patient that comes into our office. We have to determine whether you're a candidate for care or not. Let's do some detective work and find out what's out of sync. As I mentioned earlier, we do things a little bit different.
First, we're going to look at all the systems in your body and find out where the lack of communication is. The beautiful thing about this is that many times people find improvements in other areas of their health. Remember, we are not treating just your symptoms or diagnosis. We are helping your body function better. When you function better, other areas will improve.
I don't care what you've been told or who told it to you. You do not need to suffer. We have helped many people who were told they would just have to live with it. And when we cannot help, sadly we can't help everyone, I tell them that there's nothing that I know of to help you. But keep looking. There is an answer out there. That's why you're here now watching this video. That's how I came up with this whole system of treatment. I kept learning, and I will continue to keep learning. If you want us to help you, give us a call. But whatever you do, don't give up. Keep looking and keep learning.
If you decide that this is something you want to explore further, you need to follow some very important guidelines. Number 1, completely fill out all paperwork that came with your packet. I'm going to read every line. Again, this is what makes us different. Number 2, mail the paperwork to the office. We cannot set an appointment until we receive all of your paperwork. Number 3, once we receive the paperwork, our office will give you a call to set up an appointment.